Welcome to the state of Ohio. I'm Karen Kassler. As the coronavirus spreads, travel is shut down, and fear of pandemic rises across the world, there are no cases of people with the disease caused by that virus in Ohio. 6 people in Ohio have tested negative, including 2 students from Miami University in Oxford. And Health Department Director Amy Acton has designated COVID-19, the illness caused by coronavirus, a Class A disease, meaning all suspected or confirmed cases must be reported immediately. That order has been in effect since before the first case of community spread of the disease in the U.S. in California, with a patient who hadn't traveled or been in contact with someone who had been infected. With all that out there, State House correspondent Andy Chow had an important reason for looking into what's happening with coronavirus at home and abroad.
As the virus grip takes hold, there are 2 industries particularly affected, the aviation and the cruise industry that are...
And it is not being controlled adequately.
It has raised concerns that there could be transmission taking place within the pipes.
The normally bustling shopping districts, desolate. On the outside, at least.
Think you'll find and even then.
The spread of the coronavirus in China and around the globe has dominated headlines, which is causing a personal dilemma. I have 2 tickets to Taiwan and lots of questions. Is it safe to be traveling internationally right now? How serious is the threat of the virus? Or are these just unfounded fears, fueling an unfair stigma around traveling to Asia in the first place? To get answers for these questions, I went straight to the experts, doctors at The Ohio State University Wexner Medical Center in Columbus, who are well-versed not only in the pathology of infectious diseases, but in public health policies for outbreaks. First, we talked to Dr. Christina Lishaneski. She's an assistant professor of internal medicine in the Division of Infectious Diseases. In other words, if there's anyone to address fears about viruses, it's her. What kind of questions should people have or consider before they travel to countries that do have the coronavirus?
Sure, so I think probably the most important thing really is you should consider your own immune system. So people whose immune system is not normal, so people on chemotherapy, who've had transplants, who are really young or really old, their immune system is probably a little bit more hampered, and if they happen to get infected, they would have a sicker infection. They would be sicker.
So when it comes to traveling internationally, the questions basically come down to this: weighing unnecessary panic versus legitimate concerns.
So anytime you make a decision in your life, there's always a risk benefit, right? So it depends, why are you going? How important is it? Is it something that can be postponed or not? What's my immune system like? If I happen to get sick, how will I be able to handle it? What's the health care there? So those are all things that I would personally consider if I was taking a trip.
The numbers are continually changing, but as of this week, the World Health Organization reported more than 81,000 cases of the coronavirus worldwide, compared to just 12,000 on February 1st. China has the vast majority of cases, while the U.S. has more than 60 confirmed cases of the virus, and Taiwan, with a population of 20 million, has 30 cases. Meanwhile, the CDC is issuing travel warnings. The highest warns against all non-essential travel to China and South Korea. A level 2 alert has been issued for Iran, Italy, and Japan. There's no warning against travel to Taiwan. However, the CDC has labeled Taiwan as a destination with a risk of community spread. So those are the stats to consider when it comes to Dr. Lishaneski's risk-benefit analysis. But I also talked to Dr. Andrew Thomas. He's the medical center's chief clinical officer and leads a campus-wide collaboration to make sure everyone stays informed and healthy during cases of new potential outbreaks. As Thomas explains, there's something else to consider when traveling internationally: the possibility of a quarantine.
But also there is a concern of what then happens when I come back. If I have to self-quarantine for 14 days, I can't go to work, I can't go to school. Those are really practical considerations. But if someone was going to a part of China where there was a low percentage of infections and they were going to visit a sick loved one, I mean, there's reasons why people may still need to go. They just need to understand that between the CDC, the Ohio Department of Health, and the local public health department, they are going to be asked to do something very different when they get back from vacation than they probably have ever had to do before.
In fact, this week, the Ohio Department of Health reports 212 people went into self-quarantine for 2 weeks after coming to Ohio from China. But along with tracking the latest news on the coronavirus worldwide, Thomas is also working with university officials to reduce panic. This goes back to the question I had earlier about an unfair stigma. He says unnecessary panic has the potential to spiral into discrimination.
There was a lot of concern that people would, whether in what they say or in how they treat others, start to do discriminating things against people that were Asian, not wanting to go to Asian restaurants, not wanting to sit next to an Asian student in class. And obviously there's very little need to do any of those things. So trying to reassure the 99.95% of people that haven't been to China that they have much more to worry about with influenza than they do with coronavirus.
Another component to consider is the impact the virus is having on attractions. While it still seems like Taipei's famous night markets are still up and running, there are cities and countries that are restricting large gatherings and events. The CDC currently considers the risk to the general public to be low, still calling for people to be vigilant to stop the spread of germs. But medical experts are still putting out a more discouraging message that a nationwide spread of the coronavirus in the States could be imminent, and that everyone should be prepared for potential disruptions, such as school closures and working from home.
Andy, there was a lot of information in that, but one question still is unanswered here. Did you cancel your trip?
So I actually wanted the doctors to give me the answer for me. I said, should I go? And they're like, we're not going to answer that for you. Like they said, it's really a risk versus reward sort of analysis. In the end, we as a family decided we'll just postpone the trip, go another time, and just do something around here for the spring.
All right, thanks for all that information.